She's dizzy every time she stands up, and she just started a new blood pressure pill. Coincidence? Welcome back to part 2 of our hypertension review. Last time we covered risk factors, ACE inhibitors, and hypertensive crisis. Today we go deeper. Diuretics, calcium channel blockers, orthostatic hypertension, blood pressure measurement technique, hypertension in pregnancy, and more. 10 questions. Pause when I tell you, choose your answer, then check yourself. Let's go. Question 1. Pharmacology. A 60-year-old woman started a thiazide diuretic 3 weeks ago for hypertension. She returns reporting muscle cramps and general weakness. Her blood pressure is now 130/80. The nurse reviews her recent labs. Which electrolyte imbalance should the nurse anticipate? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypernatremia. Pause and choose. The answer is B. Hypokalemia. Thiazide diuretics increase excretion of both sodium and potassium in the urine, which lowers serum potassium. Muscle cramps and weakness are classic early signs of low potassium. Teach patients to eat potassium-rich foods like bananas, oranges, potatoes, and spinach, or take a prescribed supplement. Monitor for cramps, weakness, fatigue, and most dangerously, cardiac arrhythmias. Don't confuse your diuretics. Thiazides and loop diuretics waste potassium, causing hypokalemia. Potassium-sparing diuretics like spironolactone retain potassium, causing hyperkalemia. Thiazides also raise calcium mildly and can raise glucose and uric acid, but the classic tested effect is low potassium. Question 2. Patient safety. A 74-year-old man started a new antihypertensive medication yesterday. This morning, he feels dizzy and lightheaded when he stands up. His blood pressure lying down is 138/84. On standing, it drops to 116/70 with a feeling of faintness. Which instruction is the priority for the nurse to give? Pause and choose. The answer is B. Change positions slowly. This is orthostatic or postural hypotension, a drop of at least 20 millimeters of mercury systolic or 10 diastolic within 3 minutes of standing. His systolic dropped 22 points. Older adults on new antihypertensives are at high risk, and the biggest danger is a fall. Teach them to rise slowly, sit on the edge of the bed for a minute, then stand while holding something stable. Why are the others wrong? A. Never tell a patient to stop an antihypertensive on their own because of rebound hypertension. Manage the symptom first. C. Limiting fluids actually worsens orthostatic hypotension. Adequate hydration helps maintain volume. D. Blood pressure medications are taken on a schedule, not when it feels high. Patients cannot feel their blood pressure reliably. Question 3. Pharmacology. A 55-year-old man has been taking a calcium channel blocker, a dipene medication, for hypertension for 1 month. He returns reporting swelling in both ankles and feet. His blood pressure is well controlled at 126/78, and he denies shortness of breath, chest pain, or weight gain. How should the nurse interpret this finding? Pause and choose. The answer is B. Common expected peripheral edema. Dihydropyridine calcium channel blockers, the dipene drugs, cause peripheral vasodilation, which commonly leads to ankle and foot edema. Because he has no shortness of breath, no chest pain, and no weight gain, this is peripheral edema, not cardiac edema. It's a known drug effect, not heart failure. Other common effects include flushing, headache, and reflex tachycardia. Teaching point. Patients on calcium channel blockers should avoid grapefruit, which raises drug levels and increases side effects. Notice how the stem tells you what he denies. No shortness of breath, no chest pain, no weight gain. Those absences rule out heart failure and point to a benign drug side effect. The NCLEX often hides the answer in what the patient does not have. Question 4. Assessment skill. A nurse is preparing to measure a patient's blood pressure to confirm a possible diagnosis of hypertension. The nurse wants an accurate reading. Which action ensures accuracy? A. Legs crossed with feet off the floor. B. Measure immediately after the patient walks in. C. Support the arm at heart level with feet flat and back supported. D. Use a cuff smaller than the arm for a snug fit. Pause and choose. The answer is C. Arm at heart level, feet flat, back supported. Proper technique means the patient is seated quietly for 5 minutes, back supported, feet flat on the floor, legs uncrossed, and arms supported at heart level. Incorrect positioning can falsely raise or lower the reading and lead to misdiagnosis. A. Crossed legs and unsupported feet falsely raises blood pressure. B. Measuring right after activity falsely raises it. The patient must rest first. D. A cuff too small falsely raises the reading, while a cuff too large falsely lowers it. Cuff size must match the arm circumference. Question 5. Maternal health. A 29-year-old woman who is 12 weeks pregnant has chronic hypertension. She was taking an ACE inhibitor before pregnancy. She asks whether she can continue her usual blood pressure medication now that she's pregnant. Which response by the nurse is correct? Pause and choose. The answer is B. ACE inhibitors and ARBs are contraindicated in pregnancy. They are teratogenic and can cause fetal kidney damage and even death, especially in the second and third trimesters. Safer options in pregnancy include labetalol, nifedipine, and methyldopa. The patient still needs treatment because uncontrolled hypertension in pregnancy risks preeclampsia, growth restriction, and preterm birth. Here's the key pregnancy rule. Stop ACE inhibitors, ARBs, and direct renin inhibitors, all harmful to the fetus. Safer choices are labetalol, nifedipine, and methyldopa. Never tell a pregnant patient to simply stop all blood pressure medication. The goal is to switch to a safe agent, not go untreated. Question 6. Pharmacology. A 62-year-old man with resistant hypertension is prescribed a potassium-sparing diuretic, spironolactone, in addition to his current regimen. The nurse provides dietary teaching. Which food should the nurse instruct the patient to limit? A. White rice and pasta. B. Salt substitutes and bananas. C. White bread and butter. D. Apples and grapes. Pause and choose. The answer is B. Salt substitutes and bananas. Potassium-sparing diuretics like spironolactone retain potassium, so the risk is hyperkalemia. Salt substitutes are high in potassium chloride, and bananas are potassium-rich, so both raise potassium further. Teach patients to avoid salt substitutes, potassium supplements, and excess high potassium foods like bananas, oranges, potatoes, spinach, and avocados. The other options, rice, pasta, bread, apples, and grapes, are low in potassium and not a concern. Notice this is the mirror image of question 1. A thiazide wastes potassium, so the patient eats more. Spironolactone spares potassium, so the patient limits it. The NCLEX loves to test these two side by side. Always identify the diuretic type first, then decide the potassium direction. Question 7. Complications. A nurse is teaching a community class about the long-term consequences of uncontrolled hypertension. A participant asks which organs are most at risk. Which organs should the nurse identify as primary targets? Select all that apply. A. Brain. B. Heart. C. Kidneys. D. Eyes. E. Pancreas. Pause and choose all that apply. The answer is A, B, C, and D. Chronic hypertension damages organs with rich blood supplies. The classic 4 target organs are the brain, heart, kidneys, and eyes. In the brain, it raises the risk of stroke and vascular dementia. In the heart, it causes left ventricular hypertrophy, heart failure, and heart attack. In the kidneys, it causes hypertensive nephropathy, leading to chronic kidney disease. And in the eyes, it causes retinopathy, which can lead to vision loss. Why is E wrong? The pancreas is not a primary target of hypertension. Remember the target organs as the places with dense vasculature: brain, heart, kidneys, eyes. A quick memory hook. Hypertension attacks where blood flows hardest. Question 8. Health promotion. A 40-year-old man with elevated blood pressure, 126/78, wants to prevent progression to hypertension through lifestyle changes. He does no regular physical activity and asks how much exercise he should aim for. Which recommendation is most appropriate? Pause and choose. The answer is A, at least 150 minutes of moderate aerobic activity weekly. Guidelines recommend at least 150 minutes per week of moderate intensity aerobic activity, for example, 30 minutes 5 days a week. Regular aerobic exercise can lower systolic blood pressure by roughly 5 to 8 millimeters of mercury. His blood pressure of 126/78 is elevated, which is 120 to 129 systolic and under 80 diastolic. That's the ideal stage to intervene with lifestyle before medication is needed. B is too little to be effective. C wrongly excludes aerobic exercise, which is the most beneficial for blood pressure. And D misunderstands exercise as a rescue rather than a routine. Question 9. Patient education. A 50-year-old man was diagnosed with hypertension 6 months ago and prescribed daily medication. His blood pressure today is 158/96. He admits he feels completely fine, so he only takes the pills when he remembers, maybe a few times a week. Which response addresses the underlying issue? Pause and choose. The answer is B. Hypertension is called the silent killer because it usually causes no symptoms until organ damage has already occurred. The patient's belief, "I feel fine, so I don't need it," is the core misconception driving his non-adherence, and answer B directly corrects it. His blood pressure of 158/96, which is stage 2, confirms the medication isn't working at his current adherence level. A enables the dangerous behavior. C is unsafe because doubling doses can cause hypotension. And D reinforces the exact misconception we are trying to correct. Final question: nutrition. A nurse is reinforcing DASH diet teaching for a patient with hypertension. The patient is planning meals and wants heart-healthy choices to lower blood pressure. Which meal choice best reflects the DASH eating plan? A. Fried chicken, white rice, and a soft drink. B. Grilled salmon, steamed vegetables, brown rice, and fresh fruit. C. Cured ham sandwich on white bread with chips. D. Cheeseburger with fries and a milkshake. Pause and choose. The answer is B. Salmon, vegetables, brown rice, and fruit. The DASH diet, Dietary Approaches to Stop Hypertension, emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while limiting sodium, saturated fat, and added sugars. Option B fits perfectly. Lean fish, vegetables, a whole grain, and fresh fruit. A is fried, refined, and sugary. C is cured processed meat, high sodium, refined bread, and salty chips. D is high in saturated fat, sodium, and sugar. All three violate DASH principles. Key DASH targets: sodium under 2,300 milligrams a day, ideally 1,500, plus increased potassium from fruits and vegetables. Those are 10 more hypertension concepts. Thiazides cause hypokalemia. For orthostatic hypotension, rise slowly. Dipene calcium channel blockers cause ankle edema. For accurate blood pressure, support the arm at heart level. In pregnancy, no ACE inhibitors or ARBs. Use labetalol, nifedipine, or methaldopa. Spironolactone means limit potassium. The target organs are brain, heart, kidney, and eye. Aim for 150 minutes of exercise a week. Hypertension is a silent killer, so daily adherence matters. And the DASH diet means produce whole grains and lean proteins. That's 2 full parts on hypertension now. Subscribe for a new set every week and share this with a classmate. Because we don't pass alone, we pass together. See you in the next one.